Hey everybody, David the AI Guide here. Welcome to another episode. Thank you so much for tuning in. Please be sure to follow us on Facebook, Instagram, and Twitter. Also, Medium articles come out from time to time, and be sure to click the link here below to get your free AI beginner's resource, because again, every single person's job is going to use AI within 5 years. So you might as well start getting used to it and start getting to know it. And finally, please support us on Patreon. We'd really appreciate that. It'll allow us to do new things, and those include live events, more interviews, live streams from top conferences as the economy opens back up after the pandemic, etc. So please consider supporting us on Patreon. So the very last video was about chatbots, but it was about chatbots in commercial business, meaning retail and consumer-facing businesses. I was not talking in that video, though, about one of the most major consumer-facing businesses there is, which we're going to talk about today, and that is healthcare. So chatbots are going to revolutionize healthcare. Why? Think virtual doctor that is only an AI helping to take care of you. Now, how will this work? Well, there's a lot of people with conditions that require continuing care and ongoing maintenance and interaction and medication. Many of these conditions require frequent interaction with either a doctor or a nurse to check in. In addition to a doctor or nurse's regular patient load, this can really impact their time. And with the huge breakthroughs recently in natural language processing, NLP, principally with GPT-3 and new ones that are even newer and coming out now, NLP has gotten so good that it can carry on a conversation with people. So why is a chatbot such a powerful idea in healthcare? There's a bunch of reasons. First is, we mentioned it a second ago, reduce workload for doctors and nurses so that they can do that hands-on work when the patients are there physically in front of them, and the more remote care can be handled by AI. And with low-code, no-code chatbots that we talked about in the very last video, this is going to start to spread everywhere very quickly, because then this is going to be adopted not just by the biggest hospitals and the biggest medical practices, but by everybody over a little bit of time, meaning 3 years or so, because it's going to get dirt cheap and everyone's going to start using it. Other ways in which it can help healthcare providers with these chatbots, keeping track of patient data, especially people who need lots of care and have had conditions over a long period of time, some of them potentially serious. Keeping track of all the data, all the test results, all the x-rays, MRIs, all of this stuff is difficult for a human, not for an AI chatbot. So that's another use case. Another one is instant access to patient history and medical records, very similar, but a little bit different, because a lot of patient records are narrative, meaning they explain what's going on with the patient as opposed to a specific test or a MRI or X-ray or something like that. Hiring and training. This is a great case to train nurses on the job how to do things that are very specialized in a particular healthcare practice, like a healthcare practice that specializes in in significant heart disease or Alzheimer's or Lou Gehrig's, or, stuff that isn't as common as the stuff people normally go to the doctor for, but are serious and involve a lot of data. Billing and registration is an obvious one. Computers can totally take over the process of intake when you arrive to talk to a doctor or a nurse at a medical practice or show up at the hospital, and the billing it can as well. That's pretty straightforward. Accounting is mathematical and it's a perfect computerized solution. But what they're really finding that we talked about in the last video and other videos about chatbots is chatbots really increase interaction and engagement with the person significantly. And in healthcare, this will lead to much better outcomes for the patient because the interaction is much more extensive, much higher level, and is all stored and remembered. And so the patient gets better care. One other aspect of this, of course, is that being a doctor or nurse is very demanding and you get tired after a long day. Chatbots don't get tired and they don't make mistakes because they're tired. And one of the real problems with medical care is mistakes, right? This is why doctors all have malpractice insurance, because we're all human and anyone can make a mistake, including doctors and hospitals. But chatbots don't make mistakes like that, assuming they're programmed correctly. Obviously, in the healthcare setting, chatbots need a very high level of validation to make sure that the information they're giving based on the inputs is always correct. This is extremely important, but that is not an insurmountable obstacle to adoption of chatbots in healthcare settings. So just like retail, just like talking to customer service people over the phone or billing people over the phone, healthcare is going to be revolutionized by chatbots. This is the future. And when you think of all the people who are engaged in talking to people on the phone, we're talking millions and millions of people that will be impacted as chatbots roll out because of the low code, no code we talked about last time, and get cheaper and cheaper. And this will impact people globally because many of the call centers for my US audience are not local here anymore. They're in the Philippines, they're in India, they're in Central America. All these folks are going to get hit by this wave. Also, that's why I started the AI Guide, to prepare people initially focused here in the US, but focusing in the future globally on helping people cope with this huge job disruption that's coming and going to be global in impact. And it will not care whether you are a low-wage worker or a high-wage worker. You will all be impacted by this. So, word to the wise, if you're not in AI already, click the link below, get the free resource, learn more about AI. You will have to use it in your job every day within 3 to 5 years. This is a very short time frame on this. Do yourself a favor, be prepared. Follow us on Facebook, Instagram, and Twitter. Please like, subscribe, and share. And please support us on Patreon. Thank you. We'll see you next time.